let me say a few words about the President's comments last night. Even before acknowledging to Bob Woodward on tape that he was fully informed on the gravity of the danger related to COVID-19, he refused to warn the American people. Again, last night in television town hall, the President revealed in no uncertain terms the lack of seriousness with which he continues to take this pandemic. Nearly 8 months after this crisis, on the doorstep of 200,000 American deaths, President Trump has refused once again to take responsibility or to take action. By his own admission, he continued to lie about COVID-19. He doubled down on the catastrophic mistakes that he's made. And perhaps, worst of all, he made clear that he still doesn't have a plan to bring us out of this crisis. He even said, and I quote, "A lot of people think that masks are not good, undercutting the easiest, most effective means we have for reducing the spread of this disease." This virus is still taking nearly 1,000 lives a day. The forecasts show that those numbers are likely to climb this winter. But incredibly, Donald Trump insists that he wouldn't have done anything differently. Not one thing. Last Friday, we learned that another one of the thousands of Americans died due to this virus, and it continues to rise. And on the very same day that we reported 1,000 deaths on Friday, and the very same day, Canada reported that not one person died of COVID-19 in Canada. Trump wouldn't have done anything differently? If you're a parent in America, preparing for another day that your child can't attend school, if you're grieving the loss of a son, a daughter, a mother, a father, husband or wife, if you're a small business owner who's on the brink of total bankruptcy, who can't open or can't go back to work because the virus still is spreading in your community, how does it make you feel to hear the President say he wouldn't have done anything differently? And if he gets 4 more years, why should we expect anything to change? All President had to offer last night, President Trump, was the same weak and feckless inaction, the same lies and empty promises that we've seen from the very beginning. He still won't accept any responsibility. He still won't offer a plan. And last night, he repeated what he said so many times before, that even if he continues to offer only failing indifference, someday the virus is going to go away by a miracle. Even if he does nothing, it's going to go away by a miracle. It won't go away like a miracle. In fact, even if we get a vaccine, it will not be available for most of the population until well into the 2021. You know, so we're heading into a very dangerous autumn. The fact that the University of Washington model, which the White House has previously touted, projects that cases and deaths are going to spike this November and an additional by 215,000 Americans, they say, are going to die. Began the spike in November, but by the first of the year, 215,000 will be dead, additional. That's more than have already died. We need leadership right now to prevent that from happening. The same university the model shows, the University of Washington model, shows that if there's universal masking, these deaths could be, projected deaths could be cut in half. We could say between now and the end of the year, 100,000 lives. Let's assume they're off by half on all of this. 50,000 lives. 150,000 dead. Donald Trump's own director of CDC told us that wearing a mask is the single most important step we can take to curb this virus. Here's what he said. He said, "I might go so far as to say that this face mask," and he held up a face mask, not this one, "is more guaranteed to protect me against COVID than when I take a COVID vaccine," end of quote. Now, I spoke with the experts today about additional steps we can take to prevent needless deaths and suffering between now and a universal vaccine being made available. Uniform national guidelines, they said, and standards on social distancing that can be applied to, in particular circumstances of states and communities based on their particular circumstance. More effective approaches on testing and tracing. If we do these things between now and January, we could save even more lives. Last night, Donald Trump indicated he has no interest in doing these things. Folks, the president's first responsibility is to protect the American people, and he won't. That's utterly disqualifying. I also spoke with the experts this morning about the paramount importance of preparing now for swift, organized, and free distribution of a safe and effective COVID-19 vaccine when it arrives. And I'm profoundly grateful to the scientists and the researchers working tirelessly to ensure that a safe and effective vaccine becomes a reality as soon as possible. These scientists carry the hopes of our nation, our entire nation, and the entire world. And when their work comes to fruition, and it will, there will be no doubt it will save lives. But scientific breakthroughs don't care about calendars any more than the virus does. They certainly don't adhere to election cycles. And their timing, their approval, and their distribution should never, ever be distorted by political considerations. They should be determined by science and safety alone. A vaccine would offer a way back to normalcy and a path toward better days for all of us, not only here but around the world. But it's not going to happen overnight. And once we have it, it's going to take months to distribute it to the entire population. I'm more hopeful than ever in the power of science to get us there. But one thing is certain. We can't allow politics to interfere with the vaccine in any way. Americans have had to endure President Trump's incompetence and dishonesty when it comes to testing and personal protective equipment. We can't afford to repeat those fiascos when it comes to a vaccine, when it occurs. The stakes are too high. American families have already suffered and sacrificed too much. So let me be clear. I trust vaccines, I trust scientists, but I don't trust Donald Trump. And at this moment, the American people can't either. Last week, Senator Harris and I laid out 3 questions this administration is going to have to answer to assure the American people that politics will not play a role whatsoever in the vaccine process. If Donald Trump can't give answers and the administration can't give answers to these 3 questions, the American people should not have confidence. But if they can, they should have confidence in the transparency they need to trust the vaccine and adopt it in numbers that will make a difference. First question. What criteria will be used to ensure that a vaccine meets the scientific standard of safety and effectiveness? What's the criteria? Second, if the administration greenlights a vaccine, who will validate that the decision was driven by science rather than politics? What group of scientists will that be? And thirdly, how can we be sure that the distribution of the vaccine will take place safely, cost-free, and without a hint of favoritism? The fact of the matter is, development of vaccine is only part of the battle. Distributing a vaccine to the entire population is as complex and challenging as one of the most sensitive military operations. I've been calling for an effective distribution plan to be laid out for months. If I'm elected president, I'll begin by implementing an effective distribution plan from the minute I take office. That's what I discussed with the experts in the briefing today.
You just said that when it comes to a vaccine, you don't trust Donald Trump. Is there a risk that that message, that questioning the president on a vaccine, could prevent people from trusting the science, from trusting a vaccine when there finally is one?
No, because they know he doesn't have any respect for scientists. He basically said it. You saw what he said when he was out in California about wildfires, and scientists don't know, and it's going to go away like a miracle. It's necessary so people can trust the vaccine. And that's why I said that you have to have this board of scientists that are going to say, this is why we think this is a good vaccine, why it's approved, and it has to be total transparency. So scientists outside the government know exactly what is being approved, the context in which it's being approved, and why it's being approved. I think it's the only thing that takes care of that.
For a vaccine to work, though, to be effective, you do need a certain amount of the population to be willing to take it.
That's right.
You're saying, don't trust the president, trust me if I'm elected. Are you
No, I'm not.
confident that
I'm
enough
saying-
Americans
I'm saying
will buy in?
Trust the scientist. Trust the scientist. It's one thing for Donald Trump to say the vaccine is safe. Okay, then give it to the board of scientists. Have total transparency so independent operators and scientists and companies go out and take a look at it. And what did you base that decision on? What did you do? Did you pressure the head of the FDA? Did you pressure whomever? I'm not saying he would or will, but that's what has to happen. Because you know yourself, you all know the polls better than I do. The American people right now don't trust what the president says about things relating to science.
And if the scientists say a vaccine under the president's watch is safe and effective,
Absolutely.
you will take it?
Do it. Yes. If those three questions I laid out can be answered, yes, absolutely.
You don't trust the president. Does that mean you also don't trust the CDC and the FDA currently?
No. I don't trust some of the people, like the fella who just took a leave of absence from the CDC. He didn't run it, but he was a spokesperson for it. But there are some, when I met with the 7 scientists today on the screen here in this room, they told me the people that they had worked with in the CDC and the FDA and all the various agencies. And there's some very, very good people there in the ranks, the everyday folks that are, not everyday, they're scientists, but the people who do the daily work in there. And there's some very, very good people. But you know from other items that they've been quashed in things they've said, and they've been pressured. The heads of those agencies, politically appointed, some of them, have been in fact moved to say, yes, we can do this or that, or this will work or that will work. It's a simple proposition. If a vaccine is ready to go, it should be totally transparent, the basis upon which that decision was made. What scientists have looked at it within the government and outside the government and said, this is a useful, safe vaccine to take. And so that's all I'm saying. And that's going to be necessary, I'd respectfully suggest, no matter what I said in this process, because all the polling data shows now, it's something like only 30-some% of American people say, if Trump said it's okay. This is the same guy that said inject bleach. This is the same guy that said, you know, you want to keep hurricanes from getting to the United States, why don't we drop a nuclear weapon on them? I mean, you know, there's a reason why they're not so certain.